Hi, and welcome back to Bayou Time. I'm Renee Piper, and this is the Nicholls State University segment. And I have a guest with me tonight. It's Todd Keller, and Todd is the director of the Bachelor of Science nursing degree program at Nicholls.
Yes.
Great, welcome.
Thank you. Thank you.
Glad you're here. I know that nursing is one of the more popular majors on the Nicholls campus. And we're very proud of that. We graduate a lot of nurses who take care of a lot of people in the region. But when students are majoring in nursing, how do they prepare themselves for acceptance into the clinical portion of the Bachelor of Science program?
Okay. That's an excellent question. I think it's important for the students to realize that it's actually a three-step process. The first step of that is to apply to Nicholls State University, and then there is a specific set of prerequisite courses that they must meet prior to being eligible to apply to the baccalaureate nursing program. In those prerequisite hours, they must earn a minimum GPA of a 2.75 with no grade below the level of a C. It's also important to realize that those are minimal standards. We often have many more applicants than we have available seats. So academic performance is ultimately important to those students. The semester that they are eligible to apply, when they're completing those prerequisite courses, they would apply, and if they're successful as an applicant, they would begin the actual clinical portion in that very next semester. Now, in addition to applying to the baccalaureate nursing program, they must also apply to the Louisiana State Board of Nursing. And the Louisiana State Board of Nursing has the ultimate approval of whether or not that student is eligible to enter one of those programs.
Okay, so they take the core courses their first year or so at Nicholls when then they apply, but they have to meet that minimum GPA standard and hopefully exceed that before they can apply for the clinicals. Now, I've heard that there are some exciting changes that are occurring in the nursing program. Can you maybe share some of those with our audience?
Oh, absolutely. One of the major changes that we have occurring is a change in the curriculum. We have streamlined our curriculum, and we've also added some coursework to respond to the changes that we actually see in the healthcare system today. For instance, one of the things that we know is the primary population that we are caring for today and that we will care for in the future is that older adult population. For that reason, we have added a course that is very specific to the geriatric patient, or what's known as gerontic care in nursing. Another thing that we realize is that in the United States of America, as well as in our local area, the culture has become very diverse, and that has to do with race, with ethnicity, socioeconomic status. And with that diversity, we have to prepare nurses that can respond to patients that fall in different ethnic and racial and socioeconomic categories. So we've also added, of course, Cultural Diversity in America that looks at those different cultures. That's along the lines of the curriculum. We're also instituting a lot of advanced technology within the program. One of the things that will begin in the fall is a program called Nurse Squared. What Nurse Squared is a computer-based electronic health record that these students will be able to access. One of the things we know is that under President Obama's lead, it is expected that all healthcare providers will switch to electronic health records by the year 2014. Okay. In fact, those Medicare providers that do not switch by 2015 will be fined. And so we have to prepare our students to go into the workforce, into the area, and be able to interact with these advanced technologies and these computer programs and systems. We also are enhancing our simulation labs at the university, and we do have a slide with some pictures of some of the newer equipment that we have. Some of the things that we have over on the left-hand side, a new bedside medication verification system. This has to do with one of the major initiatives in our curriculum change, which is ensuring safety in patient care. So the bedside medication verification system, it's kind of like when you go to the store and they scan a barcode to get a price. The patient must be scanned, their wristband, the medication must be scanned, and the computer has information that determines whether or not it's the correct patient, the correct dose, the correct time, etc. We also have some enhancement in our IV skills lab. You can see in the two middle pictures we have IV simulation arms for intravenous access, as well as the IV hands, kind of reminiscent of the Addams family in that bottom picture.
Well, I know that's a little odd looking in the picture, but coming from someone who is scared to death of needles, I'm glad they're practicing on those arms and those hands and not on me when it's my time.
Oh, absolutely. We have to ensure proficiency before we let them into the hospitals. Over on the right-hand side, in the top picture, that is our birthing simulator, Noelle. She is able to give birth in a simulated experience, but she can be programmed for a successful, easy birthing process or a complicated birthing process, so that the students have to work through difficulties in a safe, basically no consequence lab environment prior to going into the actual clinical setting. In the bottom are two pieces of equipment that we are extremely proud of. Our brand new birthing bed, as well as our brand new infant warmers. So the students will get hands-on access to this type of equipment before ever getting into the hospital arena.
Which is fantastic training, and I know that that's comforting to future patients out there to know that they really are getting quality hands-on training before ever stepping into the hospital. Now, what's been the stimulus for these changes?
The major stimulus for these changes has come from the government. In 2008, the Institute of Medicine commissioned a 2-year study that resulted in a 2010 report about the state of health care. And out of that came a report on the future of nursing. One of the main things that came out of that was they see the need for highly educated nurses in the workforce. We know that patient care is becoming more complex. In the 20th century, the motivation for healthcare was on acute or sudden onset illnesses, as well as trauma and accidents. What we know in the 21st century is we are responding more to chronic problems, diabetes, hypertension, cardiovascular disease, mental health illnesses. And so we have to have a shift in our education. So rather than teaching rote memorization of task-oriented skills, that this is what you do when you go into the hospital, we need to be able to teach a set of very broad concepts that can be applied across all settings and in all situations. And we need to create a workforce of nurses who can think, who can be leaders, who can make decisions on the spot for the best patient outcomes.
Absolutely. Well, that's wonderful to hear that the program and all changes based on the needs of the population.
Absolutely.
Which is wonderful. Now, once students are accepted into the clinical program, what can they expect in terms of their learning experiences?
Learning experiences are varied. We're going to begin in the classroom, and we're going to give them those foundational concepts, that foundational knowledge. From there, we're going to bring them into the learning labs and the simulation labs, where they will practice their skills, and then they will have to participate in a checkoff situation for verification of the knowledge of those skills with 100% accuracy before they are allowed to go into the clinical setting. And we're very fortunate in our region because we have several major hospitals and healthcare centers that we are able to utilize for those clinical experiences.
Well, so let's talk about careers and the next step. So once they've completed their Bachelor of Science degree in nursing at Nichols, what options do they have?
Okay. It's important for them to realize that when they do complete that degree, that's all they have is a degree. The next step is to sit for the National Council licensure exam, and that is what makes them into that registered nurse. But beyond that, the baccalaureate degree in nursing is your excellent starting point, because from there, they can go into an advanced practice degree program. That can be at the master's level as a nurse practitioner, or now the doctorate level as a doctorate of nursing practice. They can go into a certified registered nurse anesthesia program. They can go into physician assistant programs. The doorway is wide open once they attain that Bachelor of Science in nursing to further their career.
And so it's not just going into the hospital environment or to a doctor's office. It's wide open, which is great. You're not limited.
Right, not limited at all.
So now, I know on the Nichols campus and on college campuses, we talk a lot about accreditation and what that means. If you could talk a little bit about that, because I know that the nursing program is due for reaccreditation in 2013, just 2 years from now. Talk about what that means and how the department is preparing for that.
Okay. When you look look at a program becoming accredited, what it's doing is undergoing a rigorous process of review, a very strenuous process of review in order to ensure excellence in that educational program. Nichols has been accredited in the nursing program since its inception. This will be a reaccreditation visit to revalidate. What we're doing to prepare for that is we are taking a very hard look at our program, and we're making changes as necessary. And again, that comes with the Institute of Medicine report. It also comes from the Quality and Safety for Nursing Education initiatives, which leads us toward safety and patient-centered care and focusing on evidence-based practice, which is the concept of instead of doing something because someone said you do it this way, it's looking at the research and learning what the best practices are to care for the patients for the best outcomes. So we're undergoing a very strenuous review of the program, and we're ensuring that things are right.
Mm-hmm. And it's important for the viewers out there to know that not all programs are accredited, and that that assures you that you're getting an excellent education. And we are at Nichols, we are accredited.
Right, absolutely.
Wonderful.
Absolutely.
Now, what other programs does the Department of Nursing offer?
Okay. You know, going back to the Institute of Medicine report where it says we need highly educated nurses, right, realizing that we offer an LPN, or a licensed practical nurse, to Bachelor of Science in Nursing articulation program, as well as an associate degree RN to baccalaureate nursing degree program. And that's, you know, to elevate their mode of thinking and their way of thinking. We also offer a continuing nursing education program for currently licensed registered nurses so that they can meet their requirements for relicensure. And we do have a slide on the upcoming programs for 2011 and 2012. These are the programs that we will be offering, and we have some clinically oriented programs. We have programs on mental health, programs that focus on care of the pediatric client, some updates on pharmacology changes, medication changes, and you can also check this on the Nichols website, the nichols.edu nursing website.
So quickly, if you'll tell us the future of nursing at Nichols.
The future of nursing at Nichols, we are looking to expand greatly. We have a lot of simulation equipment. Our ideal would be to build a simulation hospital unit within the university. Obviously, to undertake something like that would require a large financial investment. Right. We are looking into grantsmanship. We are open to community partnerships in order to build this because we are preparing the nurses of the future for our community. So we'd like to see a full unit of simulation.
Wonderful, and I think up on the screen right now we've got contact information for you, but if you could just let folks know how to get in touch with you if they're looking for more information. Okay.
Certainly. If you need more information on the baccalaureate nursing program, you can reach me directly at 448-4694, area code 985, or todd.keller@nichols.edu. If you want more direct information on the nursing program, you can go to www.nichols.edu/nursing.
Great. Thank you so much for joining me tonight, Todd. I appreciate you coming in.
Thank you. It's been a pleasure.
Great. And that will do it for the Nichols segment on Bayou Time. Coming up next, Stan Grabwall with sports.